Hi there, this is Dr. Muthu. Yes, again, I had a patient today with sickle cell disease and end-stage renal disease, which means chronic kidney problems, probably from hypertension and sickle cell disease itself, and he's getting dialysis. So he has had this ever since childhood, and he's now 20 something years old, and he's in miserable condition. So he has a lot of leg swelling. He has not been able to consistently go to dialysis because he gets pains, and his pain tolerance is so poor because of years of getting dilaudid or opiate prescriptions from our hospitals all around the city, that the amount of medication that it takes for him to control the pain right now is way higher than what people can tolerate generally, right? So over time, what happens is the nerves are not happy with the usual amount of pain medication that we give. The nerve keeps asking for more and more, because every time we push some medication, the brain is pretty shocked with the amount of pain medication that we give, and it just shuts down some of those receptors. So the next time these receptors are slightly mellowed down, and therefore it takes more medication to satisfy those receptors to control pain. So that is the vicious cycle of pain addiction medicine, right? And I don't blame him. It's not his fault. He was in pain from the sickle cell. He was in pain from leg edema, leg swelling. But over time, over years, we have just trained his nerves. And I was telling him about the gut and nervous system, how the gut nervous system can actually change the central nervous system up in your brain. Remember, you have two brains. One is in your skull, in your head. The other brain, which is actually super important, is the nervous system inside your gut. And we can reverse train the brain by training the gut. And how can we do that? By certain foods. Kitchen. Go to your kitchen. The kitchen is the pharmacy, right? So one of the most important resources that I've used is Dr. Kulrit Chowdhury's Prime, which is incorporating inputs from the field of Ayurveda, science of life. So the cumin, coriander, and fennel, right? Cumin is comino in Spanish, fennel is anise, and cilantro is nothing but cilantro, the coriander seeds. And just put this in hot water and make it in the form of a tea, and you can put it in a flask, thermos flask, and just keep drinking, sipping it all day. This is an amazing priming solution for your gut-enteric nervous system, that it starts changing the way your gut-enteral nervous system starts behaving, and it gives feedback up to the central nervous system to pacify and actually to nullify the amount of withdrawal symptoms that you get when you don't use your opiates, when you are not able to get the foods that you usually are addicted to, or when you are not able to get certain things, smoke, the nicotine, alcohol, all these things that your gut has been trained so far. Even if you don't get the same amount of these things, your brain will not feel too many withdrawal symptoms from it, right? So this is how you start priming your nervous system, and this will be the start point for him. I mentioned to him, and nobody has mentioned to him about all these things, because all we focus on is right now this admission, he's here for pain, just give him some medications, just get him out, and we'll take care of it the next time. But no, there is a chance for him to recover from this. Stop going through this vicious cycle of pain and poor pain control and pain medication, okay? And hopefully one day his pain will be under control. Hopefully one day he has changed his gut-enteric nervous system and the central nervous system pain tolerance, and therefore he'll be able to also go to his dialysis sessions more often, and potentially be motivated enough to get a kidney transplant, And then even consider a bone marrow transplant for sickle cell disease. Maybe with all of these things, including the Ann Wigmore lifestyle of living foods, maybe his sickle cell will be under much better control, right? Give it a try. You have to try it for yourself. So maybe all of you watching this video, you may have different aspects of health and disease from your own backgrounds, and you just have to keep looking for natural resources. The hospitals can give you medications for time being, right? But we cannot give you a complete cure unless you also combine it with nature food, right? So without food, we cannot give you a cure. With food, you probably don't even need us, doctors, okay? So all the best. Keep yourself motivated and keep reading. Knowledge is power. If there was anything that I can do for you, it is knowledge. Okay, bye.